Are you or someone you know using Tafluprost eye drops for glaucoma or high eye pressure? In this video, we'll cover everything you need to know about Tafluprost, including what is Tafluprost, how it works, its detailed uses, side effects, precautions, and an interesting comparison with other glaucoma eye drops. So stay with me till the end, because understanding your glaucoma medication can really help you preserve your eyesight for life. Tafluprost is a prescription medication used to lower high eye pressure in patients with open-angle glaucoma and ocular hypertension. It belongs to a class of drugs known as prostaglandin analogs, medicines that work by improving the natural outflow of fluid from the eye. This helps reduce intraocular pressure and preventing damage to the optic nerve, which is the vital structure that sends visual signals to your brain. One of its key advantages is that it's often preservative-free, which makes it gentle on sensitive eyes and safer for long-term use, especially in patients already using multiple eye drops. Let's understand briefly how Tafluprost works inside the eye. Tafluprost is a synthetic analog of prostaglandin F2-alpha. When applied to the eye, it binds to prostaglandin Fp receptors present in the ciliary muscle. Activation of these receptors increases the uveoscleral outflow. That's the natural drainage pathway for the eye's internal fluid, known as the aqueous humor. By enhancing this outflow, Tafluprost effectively reduces intraocular pressure usually within 2 to 4 hours after installation, with maximum effect seen after about 12 hours. Maintaining a lower and stable eye pressure helps protect the optic nerve and prevent progressive vision loss caused by glaucoma. Tafluprost eye drops are mainly prescribed for two important conditions. First, open-angle glaucoma. This is actually the most common form of glaucoma, where fluid builds up slowly in the eye due to resistance in drainage channels. Tafluprost helps relieve this pressure by improving fluid outflow and preventing optic nerve damage. Second, ocular hypertension. In some people, eye pressure is high, but no visible nerve damage or vision loss is present yet. Tafluprost helps reduce the risk of developing glaucoma in these patients by keeping eye pressure within a safe range. Additionally, Tafluprost is often used when other glaucoma medications like beta blockers or carbonic anhydrase inhibitors are not tolerated or, just not sufficient. It's also a great option for patients who need a preservative-free alternative to reduce eye surface irritation. Tafluprost is suitable for long-term maintenance therapy, as long as it's used regularly under your ophthalmologist's supervision. Proper usage really ensures you get the maximum benefit from your treatment, so just follow these steps. First, wash your hands thoroughly. Next, tilt your head slightly back and pull down your lower eyelid. Then, instill one drop into the affected eye once daily, preferably in the evening. After that, close your eye gently for 1 to 2 minutes and press the inner corner to reduce drainage into the nose. And finally, discard the single-use vial after application. Do not reuse it. So, just a quick reminder, using more than one drop daily won't actually improve your results, and honestly, it may even increase irritation or side effects. Tafluprost is generally well tolerated, but, some patients might experience mild side effects like eye redness or irritation, maybe an itching or burning sensation, watery eyes or even dry eyes. Sometimes you could notice a mild darkening of the eyelid skin, or a gradual increase in eyelash length or thickness. Less common, but still important side effects include permanent darkening of the iris, the colored part of your eye, blurred vision or discomfort, and in rare cases, eye pain or swelling. If you experience persistent pain, vision changes, or any severe allergic reaction, you should stop using the drops and contact your eye specialist immediately. Before using Tafluprost, it's important to inform your doctor if you have a history of uveitis, iritis, or macular edema, have undergone cataract or eye surgery recently, are pregnant or breastfeeding, or are using multiple eye medications. Always remove contact lenses before applying Tafluprost and wait 15 minutes before reinserting them. If you use more than one eye drop, just be sure to space them at least 5 minutes apart. Let's quickly compare Tafluprost with other commonly prescribed glaucoma eye drops so you can understand where it stands in modern treatment. So, first up, let's talk about Tafluprost versus Latanoprost. Both lower eye pressure effectively, but Tafluprost is available preservative-free, making it a better option for people with dry eyes or irritation. Latanoprost is widely used, but it may cause more surface discomfort in sensitive eyes. Now, let's compare Tafluprost with Travoprost. Travoprost is strong, but many formulations contain preservatives. Tafluprost is preferred for patients who need long-term therapy with minimal irritation, especially those with ocular surface disease. So, when we compare Tafluprost and Bimatoprost, it's interesting to note that Bimatoprost may lower eye pressure just a bit more, but it often leads to more redness and noticeable eyelash changes. On the other hand, Tafluprost is milder and generally better tolerated, especially when it comes to cosmetic side effects. Now, looking at Tafluprost versus Timolol, Timolol does work well, but it can affect the heart and lungs, which makes it unsuitable for quite a few patients. Tafluprost, however, has minimal systemic side effects and is usually a safer choice for people with breathing or cardiac issues. So, to sum it up, Tafluprost offers a strong pressure-lowering effect, plus the advantage of being preservative-free. That makes it a great option for patients with sensitive eyes, chronic dryness, or anyone who can't tolerate other prostaglandin eye drops. Have you ever used Tafluprost eye drops? What was your experience? Did you notice any benefits or side effects? Please share your story in the comments below. It could really help others manage their eye health better. And if you found this video helpful, don't forget to hit the like button, subscribe for more detailed health insights, and share this video with friends or family who might benefit. Thanks for watching, and remember, your eyes deserve the best care.